Hi everyone. I'm Dr. Fawzia Siddiqui. Welcome to this live video from American Migraine Foundation. I'm a neurologist. I'm a headache and sleep specialist, and I work here in Harrisonburg, Virginia, and practice here. So we'll be talking about medication overuse headaches today. And I'll be giving you a little bit information about this topic, and then talking about how do they present, what are the medications that can cause medication overuse headaches, and how do we diagnose it, and especially how do we treat them. So again, welcome everyone. I'm Dr. Fawzia Siddiqui, neurologist, headache and sleep specialist, and we'll be talking about medication overuse headaches today. It seems people are joining in, and that's nice. So this is a very, very common headache disorder, folks. We see that almost on a daily basis, and a very easily diagnosed, but it is a very challenging disorder to treat. So it is a secondary headache. So you have to have some kind of a primary headache in order to develop a medication overuse headache. So either you have a migraine headache, you have chronic migraines, you have cluster headaches, you have tension headaches, and then when you have some kind of headache, that's a pain, and what you do for a pain is you grab a pain medication, which could be an over-the-counter ibuprofen, Aleve, acetaminophen, aspirin, goody powder, or it could be something prescription such as butalbital, furanil, Furacet, and something else like a triptan, which is used for migraines in itself. So or opioids, all these medications, any of these medications can cause a medication overuse headache. So it is a very common disorder, can occur about 1 to 2% in the population, and it's very easy to go from taking a medication maybe once here and there, and then developing something called medication overuse headache. And the headache has to happen at least 15 days in a month, and the headache has to remain at least 2 or 3 months before we actually can make that diagnosis for you. The headache can present just like a typical headache. It could be in the frontal area, in your temples, in the back of the head. It could be a throbbing pain. It could be a pressure like sharp pain, or it could be just like a dull pain present throughout the day. And you could have nausea, light sensitivity with it as well. Usually when it starts off, any headache starts, what you do is you may take some aspirin, you may take some ibuprofen, and the headache goes down. And then the next day, if the headache comes back again, you may take some more ibuprofen. So you said it happened yesterday, I took ibuprofen, it took it away. So maybe I can take some more and it will take it away. And then it will bring it down, and then it might happen the next day or the next day, and you keep on taking it. And then you end up in a cycle or a vicious cycle where you get a headache and you take about 4 or 5 ibuprofen. It brings your headache down for a few hours, and then you take another 4 or 5 ibuprofen. And I can tell you how many times in a week I would see several patients like this who are taking more than 10 or 12 ibuprofen in a day to get rid of these headaches. So it's a very easy trap to fall into when you develop a headache and you feel that the medication is actually helping you to keep on taking it. And when you take medications like non-steroidals like ibuprofen, Aleve, one of those medications, and if you're taking it more than 15 days in a month, and those headaches are happening at least 3 months, then you actually have medication overuse headache. If you are taking opioids, the number of days is less. If you're doing it for 10 days in a month, you have medication overuse headache. So it's it's a clinical diagnosis that we have to make by just talking to the patients. the headaches can have other symptoms to it as well. Like you could develop irritability, anxiety, insomnia, phonophobia, just generalized fatigue with these headaches as well. And you could develop memory problems, depression as well. Um, and the over-the-counter medications that we have, they're, for use of different kinds of pain, are the ones that are mostly are the culprits for these medication overuse headaches. So like ibuprofen, aspirin, even Goodies powder, and Aleve, those are the medication. Excedrin migraine has caffeine in it, and caffeine in itself can actually exacerbate your headache more than it can relieve it if it is taken more than what is supposed to be. If you take combination pain relievers, if you take the over-the-counter medication, you take some the prescription pain medications with it, and you could develop medication overuse headaches with that as well. And again, triptans, which are very commonly used for migraine headaches, like acute abortive treatment, and someone has prescribed you sumatriptan, and you develop headache, you keep taking the sumatriptan, and you can develop the medication overuse headache from triptans and ergot derivatives as well. Opioids, again, are very notorious to give you medication overuse headache, and sometimes it becomes very challenging when you are taking opioids for something else, such as for lower back pain, and then you take it for headache as well. Then it becomes very challenging that you have developed medication overuse headache, and if you have to come off that medication, then what's going to happen to your lower back pain? So something that your doctor would have to tease out. Again, caffeine. If you take more than 200 milligrams in a day, you can increase your risk of medication overuse headache. So, as I said, Excedrin migraine has caffeine in it. It has one tablet has 65 milligram caffeine in addition to acetaminophen. And if you take two of those, you take 130. And then, if you take two every 4 or 6 hours, then you increase your dose as well. So the diagnosis of the chronic of the medication overuse headache is mostly clinical. So you would have to, if you see your neurologist or your headache specialist, and he or she was going to talk to you and just figure out how these headaches starts and what you do next, and then eventually will come to the diagnosis that you have developed medication overuse headache. It is very important that the neurologist or headache specialist make sure that there's no other type of headache that is going on with you as well. So they might order some imaging for you, like a CT scan or an MRI of the brain. Sometimes we do MRAs of the brain to look at the blood vessels of the brain to see if that's not causing the headaches as well. And sometimes lab workup to look for other metabolic causes that can give you headaches as well. So those things are used for the diagnosis. But again, the diagnosis of medication overuse headache is mostly clinical, that you have to have a chronic headache, you have to have more, at least 15 headaches in a month, and then these headaches have been ongoing for at least 3 months, and then you have to be using one of these medications either 10 or 15 days. So if you're using opioids, then it is at least 10 days in a month. If you're using opioids for headache, then it comes under medication overuse headache. If you're using the non-steroidals, such as the aspirin, the Tylenol, the non-steroidal ibuprofen, naproxen, indomethacin, and and you're using them more than 15 days in a month, then you come under medication overuse headache. Again, triptans also are 10 days in a month, 10 or more days in a month. So you have the neurologist or the headache specialist have to really tease those things out, that how much of medication are you actually taking, and if you're taking that much, then what is that cycle that you're taking, and then is it causing you the medication overuse headache? So the diagnosis is mostly clinical. The next step after we come to the diagnosis is actually a discussion with the patient, and declaring the diagnosis to them, him or her that that's what has happened. You've started taking the ibuprofen initially, and it was helping with your headache, and now you are positioned that the ibuprofen is the reason why you're having the headaches. And it's sometimes it's a very difficult discussion, because in the patient's mind, that medication is the lifesaver. It is something that is actually relieving the headache, and because the headache consumes you, it interferes in your life. You can't do what you have to do. You just keep on taking the medication. So that discussion in itself is very vital, because it makes the patient understand that this is the reason for the headache. And so we really have to be very mindful when we make that discussion, that we understand that you are taking this medication to get rid of the pain, but this is one of the reasons why you're having the pain, and we will have some options for you so that your headaches can get better. And then we discuss the treatment options. So there are many options now. So it's not like, I'm going to tell you, okay, from now on, don't take your ibuprofen, and then I'm going to just leave you right there. That's I don't think it's the right approach, because the headaches are still there, and then you're taking away the only thing that they think is causing them some relief. So usually what is the best way of doing it is to use some kind of medication to kind of take care of the headaches, and then gradually take away the ibuprofen, or the Excedrin migraine, or the acetaminophen, or the opioids, or the triptan. So you can use a Topamax, which is a very good medication for chronic migraines and some other headaches as well. I use Botox a lot for chronic migraines and these medication overuse headaches. So once these medication or this procedure start working, then you don't have as many headaches. And then when you don't have as many headaches, then you can, the patient does not feel the need to take so much of the over-the-counter medication. And then, some other procedures such as nerve blocks, trigger point injections, which are done for an acute headache as well. So, they will calm down your headache for a little bit, so that the need for taking any of the over-the-counter becomes less and less and less. And also, there's a, you would want to talk to your patient about their lifestyle as well. There are other reasons people do get headaches. So if they're not keeping themselves hydrated, water is so key to the management of headaches. So if you keep yourself hydrated, sometimes, some of your headaches do get better just like that. And, if they're consuming excessive caffeine during the day, if you're consuming excessive sodas during the day, diet sodas with aspartame in it, and then just cutting those things, or, excessive sweets, or, processed food, some of those things can also help you improve your headaches, in addition to other managements that we do to improve the headache. So it is a lengthy process, and we do also make that discussion with the patient that, when we are treating the medication overuse headache, we want the patient with managing the headaches with us. So if they should know that they are part of the team, and they're managing it as well. So like they're doing their part with keeping themselves hydrated, drinking less caffeine during the day, taking some magnesium, and in taking the treatment that we prescribe. But also the treatments could be the Botox or the Topamax and those kind of things as well. And then they have to realize, and then we have to tell them as well, that that the headaches may get worse before they actually can get better. And that's a difficult discussion again, that I'm at the end, and I'm taking 20 tablets of ibuprofen in a day, my headaches are killing me, I wake up with a pounding headache, and I go to bed with a pounding headache, and you're telling me they're going to get worse than what they are right now. And then, yes, yeah, they might. And then, and as the toxin is getting out of your body, as your body is getting relief from these agents, then, the headaches would start getting better as well. So the few weeks they would have to at least have more contact with the physician's office, so they can call if they need to, and so we can tell them what else they can do during the management of these headaches. So it's a lengthy process. It may take few weeks, it may take few months, but once they are once they are done and then you have treated that, then it is a very rewarding diagnosis as well, because you have treated medication overuse headaches. Again, all the other measures such as hydration and all the supplements can also help with the management as well. When you are done with managing the diagnosis, the medication overuse headache, and then you can then, like after 6 months, 8 months, maybe 9 months, things are doing well, you can talk about tapering the medications as well. Like started Topamax, you can talk about tapering the medication at that time. But one thing else that I usually talk to my patients as well is the side effects of this medication. Like acetaminophen, it's toxic for your liver. The ibuprofen can cause gastritis, duodenitis, ulcers, and renal failure. So going over then what is the prescribed dose is not healthy and may cause other problems for them. And that's just explaining things to people can make it easier for them to understand and then work with you to get treated for this headache.